All right, guys, we're going to discuss Chapter 8, the Skeletal System. Hold on, let me go ahead and turn off captions real quick. Okay, so before we get into the material all the way, I just wanted to have a quick discussion about this chapter. So this chapter is a little different than the other chapters that we've talked about, in the fact that there's really not any concept to understand. It's probably the most memory heavy chapter that we have had thus far. So I'm going to do a normal lecture and walk you through it, partly to try to highlight some of the things that I do need you to memorize versus don't want you to memorize. But as a whole, I think there's a lot of value in really taking your time and reading and understanding this chapter in the textbook, as well as when you go through the actual lecture slide, take a look at the notes section underneath each slide because that also has some valuable information. I wish there was a better way to truly help you guys understand and memorize exactly what you need to know. But unfortunately, this is one of those chapters where there's a lot of just definition stuff and a lot of pure memory, and there's no way around that really. So like I said, we'll go through this together. I'll highlight exactly what I want you to know. I'll try to point out what I don't want you to know, and we will go from there. All right, so when we discuss the skeleton, we break it down into two major sections. So you have your axial skeleton, which is the central and supporting aspect. So this is the white bones here in the picture. And then you have your appendicular skeleton, and that's your limbs, pelvis, shoulders. That's everything in green here. So there's 206 total bones in the skeleton. That's a little bit misleading because a lot of bones you see on multiple sides or both sides, right and left. Um, so I don't want you to memorize every single bone in the body. I think that's a lot to ask, and I think that's a bit unnecessary. And as we go through it, like I said in our little introduction, I'll try to highlight what I do want you to know. Um, as we go through this, keep in mind, I want you to know the general orientation of the skeleton. So, for example, like if I talk about the tarsals down here in the ankle, I need you to know that that's not up here in your shoulder. I need you to have a general idea of where the layout is. I don't need you to tell me every single bone that makes up the tarsals, but I need you to have a general idea of what the layout is. So one way I think is a good starting point for things is these groups, and you'll see this table in your textbook as well. So this puts them into a little bit of a grouping for you rather than just the skeleton as a whole. And I think this is a really good place to start in terms of orienting yourself to where these bones are in the body. As I said, it's a little bit misleading when we say there's 206 bones in the body because, for example, here you see this two. There's two parietal bones, so that's your left and your right. So even though there's 206 total bones, there's not necessarily 206 unique names for the bones. A lot of those bones come in pairs. So this is your groupings for the axial skeleton. And then this is your groupings for the appendicular skeleton. So take a look at these and use these to help orient you to the general location of the bones in the body. All right, this table is also in your book. These are the bone markings. So this is different characteristics and unique portions of the bone that we use to help describe what they look like and what's going on with the bone. So there's nothing really special to this table in terms of what you need to know versus don't need to know. I need you guys to memorize this for the most part. So I need you guys to know these definitions, understand what these are. I know it's a lot to ask, and I'll try to highlight this stuff as we go through the individual bones somewhat. But when it comes down to it, this table, I just need you to know whether it's making flashcards or writing these definitions out. This one's just a kind of pure memorization slide, unfortunately. All right, let's get into the actual bones themselves. So we'll start with the skull. This is part of the axial skeleton. Remember, that's that central portion. So the frontal bone here, there's just one of those that makes up your forehead. And then you have your occipital bone. Again, just one of those. And that makes up the back portion of the skull. Your sphenoid bone, we'll talk about that here in a couple of slides when we see our top-down view. I don't need you to know that super well. The ethmoid bone, super tiny bone. Don't worry about that one too much. All right, your parietal bones, you have a right and a left parietal bone, pretty large bone in the skull, and it makes up a majority of the side of your skull and some of the top. And then this lower side portion is your temporal bone, which includes your external auditory meatus. That's the opening for your ear. You can also see the zygomatic arch is in there, and that we'll talk about with the facial bones. The styloid process, don't worry about that. So I just want you to know these four main. So I want you to know frontal, occipital, parietal, temporal. When we talk about the skull, one of the features that we need to know is the suture line. So a suture is a kind of unique joint in terms of it's where two bones meet, but in a sense, it's fused. So there's not really much movement going on there. You do need to know where these are located and which bones it connects. So your coronal suture, that comes across this way, this green guy. That connects your frontal bones with the parietal bones. You have your lambdoid suture or lambdoidal suture. That connects your occipital bone with your parietal bones. Your sagittal suture, right down the middle. Think of your sagittal plane. That connects your two parietal bones. And then over this way, you can see your squamous suture, and that's going to connect your parietal bone to your temporal bone. All right, so this is that top-down view I was talking about. So just to orient you guys, this is the front, your frontal bone, forehead, and this is the back. This is your occipital bone. In orange here, you see your parietal bone. In green, you have your temporal bones. So this is what I was saying in terms of you can see the sphenoid bone forms a pretty large portion of the base of the skull and a lot of the surface area for where the brain sits. And then you also see your ethmoid bone. Again, I don't really need you to know that too much. So one feature of this sphenoid bone that I would like you to know is this sella turcica. And the only thing you need to remember about that is that that houses your pituitary gland, which is super important with your hormones and endocrine system. The main thing that I want to talk about in this slide is your foramen magnum. And so that's this big opening here. So if you think back to your bone marking slide, if you've taken a look at that already, foramen basically means a hole. So your skull in here, there's a few what they consider foramina or small openings, and that's mainly for blood vessels. But your foramen magnum is a large opening for your brainstem. And so that's where your kind of brainstem exits the skull and it'll transition into your spinal cord. The skull, because it really doesn't have any major articulations and it just has those sutures, there's really not much flexibility or give to it. So when your brain has an injury and it swells, there's really nowhere for it to go. So the only major opening is this foramen magnum. So that swelling will push that brainstem and the brain towards that foramen magnum. And sometimes that pressure can be a really major issue because our brainstem contains a lot of the portions of our nervous system that control things such as our breathing rate and our other kind of life functions. So when we get an injury in the brain and swelling forces the brain stem to push up against that foramen magnum, that can be a deadly thing. All right, moving on to the facial bones themselves. I'm going to start off with what you don't need to know. So go ahead and ignore your lacrimal bones. Those are the inner eye socket. Go ahead and ignore the vomer. That's kind of the center of your nose there. And then the nasal bone is a bit self-explanatory. That helps form your nose there itself. The three major ones that I want you to know are your mandible, that's your jaw. Your maxilla is this middle portion. The maxilla is super important because besides the mandible, all of your facial bones articulate with the maxilla. So the maxilla is kind of the major piece of the puzzle. That's what all the other pieces fit into. So without your maxilla, you really don't have a major facial structure. I highlighted the zygomatic arch when we talked about the skull bone. So your zygomatic arch is your cheekbone. So that gives your cheek its structure. And then that zygomatic bone also forms kind of the outside of your eye socket somewhat. All right, the hyoid bone. Not that this is the most important bone in the world, but I highlight this one because it's the only bone in the body that does not articulate with another bone. So every single bone in the body besides the hyoid bone is going to articulate with another bone. Clinically, one of the other reasons that we talk about the hyoid bone is because when someone dies, one thing that they will look for in the autopsy is to see if there's a fracture of the hyoid bone, which is typical of death by strangulation. So not to get morbid on you guys, but that's kind of a fun fact. But the only thing I need you guys to remember is that the hyoid bone is the only bone that does not articulate with any other bone. All right, the paranasal sinuses. These are not bones, but they are spaces. So they come in groups. There's four different ones: the sphenoid sinus, the frontal sinus, the ethmoid sinus, and the maxillary sinus. So these are named for the bones in which they kind of sit in. And so they have a couple functions. One, they make the skull lighter because it allows for space. And they also are partly for acoustics. So they help kind of reverberate sound given their space. All right, let's touch base on the differences in an infant skull versus an adult skull. So we already talked about the suture lines in the adult skull. In an infant, these have not yet fused. And so the main reason for this is that as a woman gives birth, the skull has to be able to fit through the birth canal. So if those sutures were already all the way fused, there's no flexibility in the skull, and it make it much harder for us as humans to give birth. This also allows for brain growth during infancy. So instead of being super rigid, we just talked about how if there's an injury in the brain, there's really no space. So as our brain grows, we need that space. So our skull is a little bit more flexible. So I'm sure you guys have heard of kind of like the soft spots on a skull. And so the technical term for that is a fontanelle. And that's the kind of the areas that are fibrous membranes rather than those tight sutures. And so those are the unfused bones. So over time, those areas get much smaller and they're usually kind of full sutures rather than fontanelles by age 2. All right, moving on to the vertebral column. This is still part of our axial skeleton, and this is broken down in a few different ways. So the major groups here are your cervical spine, your thoracic spine, your lumbar spine, and your sacral vertebrae. Your coccyx down here at the bottom, this purple section, and this little guy here, that's truly your tailbone. So each section has a different number of vertebrae. The vertebrae are each individual segment here. So your cervical vertebrae there's 7 there. So C1 through C7, they're named by the number. Your thoracic spine is T1 through T12, so there's 12 vertebrae. Your lumbar spine has 5 vertebrae, L1 through L5. And then your sacrum has 4 vertebrae, S1 through S4. And they're not really referred to by those determinations as much because they're really fused. So the sacrum functions kind of as one piece compared to the rest of the spine that has individual segments. So you'll also see there's a little bit of an S shape to the spine, and that is due to our curvatures. So you guys don't need to know these technical terms, but in the cervical spine and the lumbar spine, we see what's known as a lordotic curve or lordosis. In the thoracic spine and a little bit in the sacrum, we see what is known as a kyphotic curve or kyphosis. And the reason these curves develop is kind of how we develop as children. So initially, really, we can only lift our heads up. And so the C spine or cervical spine, that's our neck. And so as we lift our head up, it develops this curve here. We then move on to crawling, and that causes our thoracic curve. Of course, after crawling is walking. As we're standing tall, we get this lumbar curve. So the curves aren't there just because of how we're built. It's really more how we develop and how we progress in our movements. Okay, so each individual vertebrae is going to look a little bit different based on where it is in the spine, but they all have the same general sections. So even though each individual vertebrae don't look identical, they all have the same general parts. So the main part of the vertebrae, let me stop for a second just to orient you guys. So this is towards the front of the body. So the anterior part of the vertebrae, this is the posterior part. So this spinous process, that's like if you kind of ran your finger down the center of your spine, all those bumps you feel, you're feeling your spinous process there. You also have transverse processes. And so those lie off to the side. So if you drop, say, an inch or so off the center of your spine and press in, you can feel some harder landmarks. That's your transverse process. Your lamina is what connects your spinous process to your transverse process. That's kind of this intermittent portion. And then this main portion here is known as the body of the vertebrae. We already discussed foramen means a hole. So your vertebral foramen, this is where your spinal cord is going to run. So this is the opening so that your spinal cord can run in between. You also see you cannot see it in this picture because of the angle. We're looking kind of top down. But if we looked at it from the side, you'll also see your transverse foramen. And that's where your nerve exits. So as the vertebrae stack on top of each other, the transverse processes form another foramen where your nerves can exit so they can get to your arms and legs. All right, here's another example. So this is that transverse foramen that I was just talking about. This gray guy is a nerve. So you see as they stack, these transverse processes kind of form an opening for those nerves to come out. This spinal cord here, that's running through your vertebral foramen. So again, just to orient you guys, we have anterior, that's the body. And then back here, you can't see it quite as well, but that would be where your spinous processes are. So that's the posterior portion of your spine. So in between each vertebrae is an intervertebral disc. So that's made up of the annulus fibrosus. This is a super tough kind of outer shell. Then you have your nucleus pulposus. This is more of a fluid-like gel structure that gives your intervertebral disc a little bit of flexibility. One of the best analogies for that is kind of like a jelly donut, is something that you'll commonly hear as an example for the intervertebral disc, where this annulus fibrosus is kind of the dough, and in here you got the jelly. So sometimes, if you've ever heard of the term herniated disc, that means there's a rip in the annulus fibrosus, and some of this nucleus pulposus is starting to herniate out. And so I know I'm kind of moving my arrow this way, but typically the problem with that is when it herniates this way, that extra material that's exiting from the nucleus pulposus irritates the nerve itself, and that can cause people a lot of pain and issues. All right, this is kind of our special vertebrae that we're going to talk about. This is all the way at the top of the chain. This is in our cervical spine, our top two vertebrae. So we have our atlas, which holds our skull and occiput. You can see where the skull kind of rests into there. And so it's responsible for our nodding movement. So when we say yes. Our axis, which is the second vertebrae, C2, it does our side-to-side movement. So when we say no. So do you want to be number one? Yes. Do you want to get second place? No. So one of the ways to remember that the atlas sits on the axis is just alphabetical order. So T comes before X, C1 comes before C2. A very important feature of the axis is the dens. And so that mainly just kind of allows the head to swivel side to side. So this is just another picture that shows the atlas sitting on the axis. So as I said, T before X, the atlas is C1, the axis is C2. You still have a spinous process and transverse process, even though they don't look quite the same. As we said, the atlas is responsible for that up and down motion, nodding yes. The dens articulating with the axis allows for that swivel. So our axis is responsible for our side-to-side motion. This here is known as the transverse ligament that helps kind of hold the dens in place and gives a lot of structure to this C1, C2 complex. Don't worry about that too much though. All right, moving on down the chain to the thoracic cage. So this is still part of our axial skeleton. So we'll start off with the sternum. It has a few different parts to it. You have the manubrium, the body, and the xiphoid process. So all three of those make up the sternum. You then have the ribs, which insert into the sternum. So you'll see them numbered here. You have 7 true ribs, and those kind of truly connect to the body of the sternum, or the manubrium up here. You see the very first one. Then you have these false ribs, which have a connection, but only by cartilage. So you see number 7's cartilage runs straight to there. 8, 9, and 10 run into rib 7's cartilage before they make their articulation. You also have floating ribs, 11 and 12. So those don't wrap all the way around. They kind of are smaller ribs, and they only sit posterior. You also have your clavicle, or your collarbone is another word for that attaches into the manubrium. And then you see your scapula on this back portion. So those are actually parts of the appendicular skeleton. It's really your sternum, all three parts, and your ribs that are part of the axial portion of the skeleton. All right, so now moving on to the appendicular skeleton. So you'll see in the notes section, I highlight a few different parts of the scapula as kind of the pectoral girdle, or the support for your upper limb. Don't get too caught up in the little attachments of stuff. I don't need you to know like the acromion process and coracoid process. I want you guys to know the major bones. And as I said before, kind of just knowing that these are part of your upper limb. So the upper part of your arm is the humerus that articulates with the acromion, and this is known as your glenohumeral joint. So the big arm, upper arm bone is your humerus. The lower portion of your arm and your forearm is made up of the radius and the ulna. So your radius is on the thumb side, your ulna is on the pinky side. So I don't know if you guys have ever heard of the terms radial deviation and ulnar deviation, but radial deviation is when we move our wrist towards our thumb. Ulnar deviation is when we move our pinky or our wrist towards our pinky. So the radius is thumb side, ulna is pinky side, and those work together to give us our forearm movements. All right, the hand itself. So the carpals are your wrist bones. They kind of, we used to say in physical therapy school that the wrist bones are like Tetris. They all have super weird shapes and they all fit together very particularly, but they allow for a lot of different movements of your wrist. Your metacarpals are between your wrist and your fingers. And then you have your phalanges, which are your finger bones themselves. So don't worry about these terms over to the side. That gets a little bit too in-depth. I don't need you guys to know that. You need to know the main distribution. So the carpals are your wrist bones. Your metacarpals connect to your fingers and your wrist. And the phalanges are your actual finger bones. And then you'll see down here, the carpals articulate with your ulna and radius. Remember, those are your forearms. So radius on the thumb side, ulna on the pinky side. All right, your pelvic girdle, even though it's pretty central, it's considered appendicular. Your sacrum itself is considered axial, but the pelvic girdle itself is part of the appendicular skeleton. And so you see the pelvis is made up of the sacrum and the os coxae, and I'll show you the os coxae by itself here in a second. But that has three different parts. You have the ilium, that's your bigger kind of hip bone, pelvis bone. You have your pubis, and you have your ischium. Your ischium is kind of your sit bone. So if you poke in your butt and you feel kind of where the hard spot is, that's part of your ischium. You then have your symphysis pubis that joins the two parts. That's a really thick piece of cartilage. All right, so the technical term for the pelvis without the sacrum, so the true appendicular part of the pelvis, is the os coxae. So this is a lateral view of it. You have your ilium again. The top of it is known as the iliac crest. You have your ischium with the ischial tuberosity. That's that sit bone that I was talking about in the last slide. And then you have your pubis. That's that anterior portion of it. So some of these guys here, I don't need you to know. The main one that I want you to keep in mind is the acetabulum is your hip joint, and the ischial tuberosity is your sit bone. That's the bone that you sit, and your hamstrings attached to that as well. All right, your pelvis itself, like I said, this is kind of a combination of appendicular and axial. If we take the sacrum out of it, we have all axial portions, but the sacrum itself is considered, I'm sorry, if we take the sacrum out of it, we have all appendicular portions. The sacrum itself is axial, and the pelvis as a whole has both portions. So you'll see here your true pelvis is everything that's kind of contained in the circle here. Your false pelvis includes the flare outs of your ilium in the iliac crest. Don't worry too much about true pelvis, false pelvis. I'm not going to test you on that. All right, moving farther down the chain, you have your femur. So the head of the femur articulates with the acetabulum. Remember, that's your hip joint on the lateral portion of the os coxae. So the greater trochanter and lesser trochanter, those are some major attachment points for a lot of your gluteal muscles and other muscles of the leg. You have the shaft here, so this is a long bone, so that's your diaphysis. And then you have your medial epicondyle and lateral epicondyle. Take a look back at the bone markings to understand the trochanter and epicondyle terms. And so this is going to make up the top portion of your knee joint. So the femur is the largest bone in the body, or I shouldn't even say the largest, it's the longest bone in the body. Moving on, your tibia and fibula. So this is the bottom portion of your femur, lateral epicondyle, medial epicondyle. This is the tibial plateau here. And your tibia is this kind of shin bone, the main portion, and your fibula is on the lateral side. And then your patella kind of floats in between or on top of the femur and tibial articulation. So remember, your patella is a sesamoid bone, meaning it floats in between tendons. So it's suspended by your quad tendon and your patellar tendon, which you can't see in the picture. So at the bottom portion of your tibia and fibula, your tibia runs down, and that's your medial malleolus. Your fibula runs down and turns into your lateral malleolus. So if you take a look down at your ankle, the bump on the outer portion or lateral portion of your ankle, that's your lateral malleolus. The bump on the inner portion of the ankle, that's your medial malleolus. So the foot and ankle is kind of similar to the hand in terms of the way it's broken down. So we're going to start down this way. This is truly considered your ankle. And so your ankle is known as your tarsal bones. So your calcaneus, that's your heel. Remember the calcaneal region from way back, that's the heel portion. Your talus is what sits directly under your tibia and connects your tibia to your calcaneus. Your navicular and cuboid and cuneiforms are all part of your tarsals. They have a large role in your foot being able to adapt to a bunch of different surfaces and stuff like that. Don't get caught up in all the names of these bones. If anything, know that your calcaneus is your heel bone, but in terms of talus, cuboid, navicular, cuneiforms, know that they're part of the tarsal group, but don't feel like you need to know those individually. The metatarsals are this kind of midfoot portion, and so that connects our tarsals to our phalanges. And then we have our phalanges, just like the hand, where our phalanges are our fingers, these are our toes. All right, just to give you guys a couple of ideas of questions that you'll see for this chapter, we'll do some practice questions here. There will be a quiz that is specific to chapter 8 because I think it's a bit hectic in terms of the memorization part of things. So I want to give you guys some more examples of questions. So we will have a quiz that is specific to chapter 8. That'll be very similar to what you see for chapter 8 on our next exam. Okay, so first practice question, which bone or bones form the foundation of the face? A, the zygomatic bones, B, the maxillae, C, the occipital bone, D, the mandible. So think about this one. Look back at your facial bone slides if you need to. And the correct answer is B, maxillae. So remember, all the facial bones besides your mandible or jaw articulate with the maxillae. So it's the glue that holds everything together. It's the most important puzzle piece. Our zygomatic bones are our cheeks. So that zygomatic arch is kind of the shape of our cheek, and it also forms the outer edge of the orbit. The occipital bone is in the back of the skull, and the mandible is the jaw itself. So that's the only bone that does not articulate with the maxillae. Question number 2. What is the purpose of the dens, also known as the odontoid process? A, it allows the head to nod back and forth. B, it allows the head to swivel side to side. B or C, it balances the skull on top of the vertebral column. Or D, it is an attachment point for ligaments. And the answer is B. It allows the head to swivel side to side. So remember, Atlas, do you want to be number 1? Yes. Axis, C2, do you want to be number 2? No. Side to side. So as I just said, the Atlas does our nodding yes. The skull itself is supported by the atlas. Remember, T is before X. So skull, then atlas, then axis. And we talked about that transverse ligament that kind of holds the dens in place is an important for the structural integrity, but it doesn't actually attach to the dens itself. All right, next question. What is the os coxae? So A, it consists of the clavicle and scapula and supports the arm. B is another name for the sacroiliac joint. C, it consists of 3 bones fused together to form the foundation of the pelvis. Or D, it is the large. Sorry, I think I could have wrote that a little bit better. D, it is another name for the sacroiliac joint flaring portion of the hip. I think I kind of combined 2. Sorry, guys. So C, it consists of 3 bones fused together to form the foundation of the pelvis. So remember, the os coxae consists of the ilium, the ischium, and the pubis all fused together. And then our 2 os coxae together with the sacrum form the pelvic girdle. The clavicle and the scapula form the pectoral girdle. That's what is kind of our base for the upper extremity. The os coxae articulates with our sacrum. That's your sacroiliac joint. That's the whole thing put together. But the sacrum where it joins with the os coxae, that's your sacroiliac joint. And then the ilium itself is the large flaring section of the os coxae. All right, question 4. To form the hip joint, the head of the femur rests in the A, ilium, B, ischium, C, obturator foramen, or D, acetabulum. The correct answer is D, acetabulum. Remember, that was one of the few extra terms I wanted you guys to know when we talked about that slide. So the ilium is the upper flaring portion of the os coxae. The ischium contains our lower portion, that's our sit bone. And then the obturator foramen is a hole below the acetabulum. Like I said, you guys don't need to memorize that necessarily. And then question 5, kind of putting it all together. This is a similar question to ones that you'll see on your quiz and exam in terms of being able to relate the bones and their region to each other. So the scapula is blank to the manubrium. Is it A, superior, B, inferior, C, anterior, or D, posterior? And the correct answer is D, posterior. So the scapula is the shoulder blade that lays kind of atop the posterior portion of the ribs. And then the manubrium is the part of the body of the sternum. So it's kind of the top portion of the sternum. The body's that main portion. And it articulates with the ribs at the anterior midline of the body. So the scapula is posterior to the manubrium. All right, that's the end of our lecture for this one. Like I said, please take your time going through the chapter in your textbook. Please take your time with your lab activities this week. I really wish that I could make this one easier for you guys memorization wise, but this one is really one where make your flashcards, write things out, draw it out. There's not a lot of concepts, so I think in a way that makes things easier. But there is a lot of memorization. So don't memorize every single bone in the body and exactly where it is, but make sure that you're familiar with where they are in relation to each other, and have a general idea for where the bones are in the body, and know your bone markings. The bone markings you do need to know. If you guys have any questions about this chapter or want any more clarification, please reach out to me via email. And like I said, we will have a quiz on this stuff so that you guys can have a better idea of exactly what types of questions you should prepare for your exam. All right. Have a good night.